Amber. My name is Becky, and I'll be your nurse today at Rhodes State College.
Yes.
I am going to let you know I am shutting the door for privacy, or I will pull the curtain.
Okay.
So, Amber, the reason I am here is to do your head-to-toe assessment.
Okay.
So, let's go ahead and get you identified. When I do a head-to-toe assessment, it literally is going to be from head to toe. We'll assess everything. All right. First and last name.
Amber Packelhofer.
Date of birth.
8/31/85.
Very good. So it matches with the chart, and I'm going to let you know that if she had a band, I'm going to match it to the chart and with what she said. So, do you have any pains, concerns, or fears you need to discuss today?
Nope.
Alrighty. What I'm going to do is I'm going to assess for lines, tubes, and drains throughout each assessment of the body. I'm going to look for patency, color, odor, consistency, and amount.
Okay.
There's no lines, tubes, or drains. I need for you to sit up. Do you need help?
Nope, I'm good.
Okay. So what I'm going to do now is I'm going to assess vital signs. They're all within normal limits. I'm also going to let you know that her assessment is going to be per her condition, her activity level, and her diagnosis. So what we're going to do is we're going to start at the head. We're going to do a level of consciousness.
Okay.
So I just need for you to answer a couple questions.
Okay.
Give me your first and last name.
Amber Packelhofer.
Where are we at?
Rhodes State.
And what day of the week is it?
Tuesday.
Very good. Now I'm going to go ahead and I'm going to assess your eyes. With the lights on, I've got a gauge on my light, and I can see bilaterally Amber's eyes are a 3. Now when we dim the lights and I turn the light on, I can see Amber's eyes, it is kind of bright, isn't it?
You're fine.
Constricts to a 2. So I'm going to let you know that her pupils are equal, round, react to light, and they do constrict from a 3 to a 2 in light. So now what we're going to do is we're going to assess the skin. We're going to assess the arms.
Okay.
I don't need the gloves for right now. So what I'm going to look for is I'm going to look for warmth, color, moisture, sensation, and movement. So Amber, can you feel my hands?
Yes.
Okay, do you have any numbness or tingling going on?
No.
And can you wiggle your fingers?
Yes.
So I'm going to document that her skin was pink or normal for race, dry, warm, no complaints of numbness or tingling, and movement is free bilaterally. So now we're going to do skin turgor and cap refill. So go ahead and let me see your thumbs. And okay, now what I need to do is I need to pinch your skin and you snap back like a rubber band. One more thing, go ahead and squeeze. There you go. I'm going to document that cap refill and skin turgor is less than 3, and bilaterally the hand grasp is strong. Give me a second here because I'm starting to go blank. Give me a couple seconds here.
You're fine. Don't get nervous.
Oh, I know what it is. Superman. So what I need for you to do is, sweetie, I need for you to put your arms out, but put your palms up. Very good. Now, Miss Amber, I'm going to have you hold that for 10 to 30 seconds, and I'm going to let you know that she is negative for arm drift. Okay, very good, Amber. Thank you. So now we're ready to assess the heart. So, I am so sorry for that pause.
You're okay.
Oh, so nerve-wracking sometimes. So what I'm going to do is I'm going to look for the jugular notch and the the angle of Louis. So right here, sorry for my cold hands, is the jugular notch. I'm going to look for the angle of Louis, which is also the second intercostal space. So let's go ahead. Let's listen to the aortic. Jugular notch, angle of Louis. Is that the second intercostal space?
Mm-hmm.
Bell, diaphragm. We need the pulmonic, jugular, intercostal space. Can you see okay?
Yeah.
Okay. Jugular, angle of Louis. We're going to listen to the pulmonic, bell, diaphragm. Now we need the tricuspid. And the tricuspid we can listen on either side. We're going to go again, jugular, angle of Louis. And since we're at the angle of Louis, we know that's the second intercostal space, and we need to go down to the fourth intercostal space. So we're going to listen. Let me put my stethoscope back in my bell diaphragm. Now, and we can, like I said, we can do that on either side. So now what we're going to do is we're going to go for the mitral. So we're going to go for the midclavicular line, and we're going to go down, since we know where the angle of Louis is, second, third, fourth, fifth intercostal space at the midclavicular, and it's going to be a little to the left of that. So I'm going to listen bell diaphragm. So literally, what I'm going to do right now is, I know with Amber, I've been practicing with her enough, her best heart rate that I can always hear is the pulmonic on her left side. So let's go ahead, and Gracie, literally, this is going to be a minute. I'm going to listen.
Sorry.
Wait, you're okay. Jugular, angle of Louis, right there. Got it. We got 25 seconds. Ten seconds. Okay, that's been 1 minute. I seriously thought you were going to be Brady. Her rhythm is regular. I keep wanting to say sinus, regular, and her rate is at 60. So now what we're going to go ahead and do is we're going to listen to her lungs. We're going to listen anterior, the side, and posterior. So the first place what we need to do is we need to find the supraclavicular notch and come down to that angle of Louis again, to the second intercostal space. Then we're going to listen right there on both sides. Then what we're going to do is supraclavicular notch, and we're going to go down to the fifth intercostal space. So go ahead, let's do that again. Supraclavicular notch, angle of Louis. Okay, deep breath in and out. Very good. Okay, other side. Supraclavicular notch, angle of Louis. In and out. Very good. Okay, so now we're going to go to the supraclavicular notch, go down to the fifth intercostal space. Deep breath in and out. And then we're going to do the same thing on this side, supraclavicular notch, fifth intercostal space. Deep breath in and out. Very good. Now, we're going to do the sides. So, go ahead. Yeah, just put both your arms up, because I'm going to need them up sooner or later. Now, Gracie, what we're going to end up doing is her posterior, I'm going to have her sit in that chair. Okay, and then I'll just have you stand over there. So, we look at the axilla, and we look at the eighth rib. And we're going to listen about right here. Same thing on the other side. No, actually, honey, I'm going to need you over there anyhow. Thank you. The axilla, the eighth rib, and we're going to go ahead and listen. Good deep breath in and out. All right, Miss Amber. Be careful, because you're barefoot and this is great. I don't want you to hurt yourself. What I need to do is I need for you to sit and look forward.
Sure. You can come over here, Gracie, if you want.
And what I'm going to do is posterior lung sound. So this is what I'm looking for. Go ahead and bend your neck down. There you go. There's a lump right here at C7. And then about right here is T10. The best way to describe T10 is maybe below the bra line if you're assessing a man. So what I need to do is on this line that I'm making, I need to listen 3 times over here and 3 times over here. And I need to make sure I don't hit any bony prominences. So C7, we're going to listen 1, 2, 3, 4, 5, 6. Good deep breaths in and out. Did not hit any bony prominences. Every time I listened to her lungs, anteriorly, on the sides, posteriorly, she was clear throughout. So what I'm going to do now is I'm going to go ahead and I'm going to watch her breathe. And I can see her pattern is regular, her depth is moderate, and her chest expansion is symmetrical. So go ahead, because we'll go ahead and lay you down.
Okay.
And I will play
It's hard to get.
with the belly. This is actually my favorite part of the assessment. I don't know why.
Mine's a heart.
Oh, I just love listening to bowel sounds. Okay, so what I'm going to tell you is she is flat and non-distended. And then we're going to start with the bowel sounds at the ileocecal valve right here. We're going to listen 5 to 15 seconds. I can hear the snap, crackle, pop. We're going to go up 5 to 15 seconds. Good. On the other side of the umbilicus, 5 to 15 seconds. Very good. Got that snap, crackle, and pop going. And then we're going to listen for the 4th time, 5 to 15 seconds. All right. Now, what I'm going to do, I guess I'm done. I don't know why I get the biggest kick out listening to everyone's bowel sounds, but I do. Okay, so what I'm going to do now is I'm going to palpate.
Okay.
Amber, does this hurt?
No pain.
No pain, no tenderness?
No.
Okay. I don't feel any masses. So now what we're going to do is we're going to go ahead and we're going to move further down and we're going to do the legs. Now, like I did the arms, I'm going to, oh, I guess I should stand right there. Actually, before I go any further, I'm going to let you know, I'm going to assess her legs like I did her arms for warmth, color, moisture, sensation, and movement. So, I'm going to go ahead. Amber, are you okay if I move your pant legs up to your knees?
I probably have hairy legs.
Oh, I don't care, honey. You should see what my legs look like after I've shaved them without my contacts in. It's horrid. Okay, so I'm going to go ahead. Warmth, moisture, sensation, color. Can you feel my cold hands?
Yes.
Okay. Can you wiggle your toes?
Yes.
Okay. Now what I'm going to do is we're going to do pedal push and pull.
Okay.
So up to your nose, speed away from the cop. Speed, speed, speed. There you go. Very good. Now I'm going to do dorsalis pedis. This can be difficult. You got to start right here, but move your way down. Okay. I can feel that. And then we're going to go to the posterior tibialis. I don't know why, but that's a tongue twister for me. All right. So what I'm going to let you know is she was warm, she was pink or normal for race, she was dry, no complaints of numbness or tingling. Movement was free in the toes bilaterally. Her posterior, her dorsalis pedis pulses were strong bilaterally. Posterior tibialis pulses were strong bilaterally. Pedal push and pull was strong bilaterally. Now what I need to look for is edema. I'm going to hold for 5 seconds over bony prominences. I am not seeing any edema. And what's going through my mind right now is I may have forgotten to verbalize that her bowel sounds, and I am so sorry, her bowel sounds, if I didn't hear anything, I would go back and listen for 5 minutes instead of the 5 to 15 seconds. If I didn't verbalize that before, I do apologize. Okay, so...
I can pull them back down. It's no big deal.
Oh, okay.
I can get them. Yeah. I'll
Okay.
get them later. I'll get them later, Becky.
Oh, okay, okay. I'm sorry.
You're fine.
Okay. So now what we're going to do is, are you able to roll to your side?
Yeah, I can roll.
Okay. I need to assess for skin breakdown. So I'm going to look for the coccyx. I'm going to look at the heels. I'm going to look for bruising. I'm going to look for skin breakdown, pressure ulcers. There's none here, and I will document that. Yeah, you can come. You go ahead
Okay.
and roll back. So now what I'm going to do is I'm going to hit the button. I'm going to lower the bed to a safe position for Amber. Give her call light. Raise the head to where she needs for it to be for comfort level. Put the railings up. Have at least one of those railings down at all times. And I'm going to go ahead and document my findings. And then I'm going to go ahead and cleanse my hands right now, since I am done with the head to toe. So, one last thing before I go. Do you have anything you need to discuss with me before I grab your pills?
Oh, you did good.
Okay, thank you very much. You guys have a great day.